Good morning. My name is Dr. Jeremy McAnulty from New South Wales Health, and welcome to our COVID update for the 5th of October, Tuesday. In the 24 hours to 8 o'clock last night, 608 locally acquired cases were reported in New South Wales. In the same period, 85,642 COVID tests were reported. Across New South Wales, we now have 88.5% of people aged 16 and over who have received their first dose of vaccine, and 67.5% who are fully vaccinated. The total number of vaccines administered in New South Wales is now 10.4 million. In terms of hospitalisations, there are currently 978 COVID cases admitted to hospital, with 190 people in intensive care, 94 of whom require ventilation. Of those people in ICU, the 190, 136 are not vaccinated, 39 people have received one dose of COVID vaccine, and 15 people have received 2 doses of COVID vaccine. In terms of deaths, sadly we're reporting the deaths of 7 people from yesterday, 6 men and 1 woman. 1 person was in their 50s, 2 people were in their 60s, 3 people were in their 70s, and 1 person was in their 80s. 5 people were from southwestern Sydney, 1 person was from western Sydney, and 1 person was from Dubbo. 5 people were not vaccinated, and 2 people who had received 1 dose of vaccine. We'd like to extend our deepest sympathies to the families and loved ones of these people who have died. There have been a total of 385 COVID-related deaths in New South Wales since the 16th of June 2021, and a total of 441 deaths since the beginning of the pandemic. The suburbs with the highest case numbers from yesterday are Casula, Liverpool, Bankstown, Punchbowl, Ashcroft, Minto, Granville, Guildford and Jindabyne in southern New South Wales. But no matter where you are in New South Wales, it's important you come forward for testing as soon as you get the mildest of symptoms, and get tested on the day you get the symptoms. The sooner we can find a person with COVID, then the sooner we can help prevent further spread in the community. I'd like to give you a breakdown of cases in the regions now. In Illawarra, Shellhaven area, we've seen 51 new cases reported to 8 o'clock last night. These include 34 from the Wollongong LGA, 11 from Shellharbour LGA, and 6 from Shellhaven LGA. In the Hunter, 65 new cases were reported, including 27 in Lake Macquarie LGA, 13 in the Maitland LGA, 8 in Newcastle, 6 in Gunnedah, 4 in Cessnock, 2 in Port Stephens, 2 in Mid-Coast, 1 in Muswellbrook, 1 in Liverpool Plains LGA, and 1 in Singleton LGA. On the Central Coast, 28 new cases were reported. In northern New South Wales, 6 new cases were reported, including 5 in the Richmond Valley and 1 in Kyogle LGA. In southern New South Wales, 19 new cases have been reported, and these include 8 from the Queanbeyan Pellerang region, 10 from the snowy Monero, and 1 from Euro-Bedalla. In western New South Wales, we've seen 8 new cases, including 4 in Wellington, 2 in Narromine, and 1 each in Cowra and Dubbo. In Murrumbidgee, LHD, 1 new case has been reported. On the mid-north coast, there have been 2 new cases, 1 each in Kempsey and Port Macquarie Hastings LGA. And in the Southern Highlands, we've seen 3 new cases reported in the Wingecarribee Shire, and no new cases yesterday in the far west, which is good news. So we're seeing a decline in numbers in recent days, but we've also seen a slight decline in testing. So I'd really encourage people to come forward for testing as we get closer to more people being vaccinated in the community. It's really important we all maintain our vigilance for symptoms and come forward for testing so we don't miss cases. By finding people with COVID, we can help you're cared for, but also importantly ensure that you're community is cared for as well. So please keep up the vaccinations. Thank you for coming forward, for getting vaccinated and getting your second dose when you're due for it, and helping protect us all. Thanks very much.